thank you all for coming to listen to us this morning. I'm Norris. I'm President and CEO of the Iowa Hospital Association, and our organization is here with several other organizations to speak to the issue of the expansion of Medicaid. Now, although all these organizations are listed on the placard to my left, this is not a formal coalition. All of these organizations and representing their membership have come to support expansion of Medicaid for their own reasons. And I'm here this morning to talk about why the hospital community is in unanimous support of expanding the Medicaid program. First of all, we believe that it's at least a win-win, if not a win-win-win for Iowa. It definitely would be a win for the 90,000 additional Iowans that we could provide insurance coverage to. It definitely would be a win for state government because it would save state government money in the initial phases, and I'll speak to that in a second. But it would also be a win for Iowa business in terms of job creation and economic activity. I'm going to speak to that as well. For the first time in nearly 50 years, and the only time with the unprecedented support that we're going to receive from the federal government by way of the federal government paying for 100% of this additional population's insurance coverage, the state of Iowa can reach out to those in need and provide insurance coverage to 90,000 Iowans. Iowa hospitals support it for the following reasons. Now, all of our organizations have electronic media, social media, and you can go and get all the detail that you need. So I'm just going to quickly hit 3 or 4 bullet points as to why hospitals support it. And I also want to respond to some of the opposing views that we've heard so far in response to Medicaid expansion. First and foremost, the reason that Iowa hospitals support expanding Medicaid is that we'll provide insurance coverage to 90,000, up to 90,000 more Iowans. Secondly, it will lead to improved health of those 90,000 Iowans. Thirdly, it will make Iowa business more competitive by mitigating the current cost shift that occurs to private insurance when uninsured individuals present themselves for care at the hospital. Fourthly, it will lead to jobs and improve Iowa's economy in an industry that currently provides a $6 billion impact to Iowa's economy and employs 70,000 individuals. It will also save the state, as I mentioned earlier, approximately $90 million in general fund dollars, which the state could set aside in a trust fund and use for future demands of the Medicaid program. I'd like to switch and respond to some of the opposing views you've heard to expanding Medicaid. The first one that you've heard is that IoCare, which is a limited expanded Medicaid program, which Iowa has operated for the past several years, is an alternative to provide coverage to these 90,000 individuals. It is not. No matter what type of changes you make to the IoCare program, it will not cover 90,000 more individuals. You've also heard the argument that expansion is not a guarantee to improved outcomes and greater quality. Quite the opposite is true. We've placed out around the room about 50 copies of the 2013 Triple Aim report that the Iowa Hospital Association puts out for its members and for the general public, and sets forth several measures. These are measures that the federal government is currently using to evaluate how well and efficiently you're providing health care in your state. And it's broken down into 3 primary areas. It's broken down into quality, and it's broken down into community health status, and it's broken down into financial performance. Our overall state performance for the quality metrics is 20. We're 20th in the country. I'm not going to detail these for you. Take a look at them. But there are some obvious ones that you'll see will not improve without providing insurance to those 90,000 individuals. Secondly, in terms of community health, things that the federal government is evaluating states on include lack of health insurance, overall health ranking, high cholesterol, percent of adults who are obese, and infectious disease. Take a look at our rankings and tell me how we'll improve those rankings without providing insurance to an additional 90,000 individuals through Medicaid. So, contrary to the argument that there are no guarantees that quality and outcomes will improve, there in fact is a guarantee that they will improve. Just look at the metrics. Lastly, I want to respond to the opposing view that failure to expand Medicaid is somehow the result of poor deal-making by hospitals during the national health reform debate. It is not. I'm not going to go into detail on that, but we can go into a lot of detail on the substance if we need to in follow-up questions. Iowa hospitals believe there exists no good political or substantive public policy justification for state policymakers' failure to act on this historic opportunity that positively impacts all Iowans and specifically lifts up 90,000 of our fellow citizens. I'm going to turn the podium over now to Tony Vola with AARP.
Thank you. Good morning. I'm Tony Vola. I'm the state president of AARP and an advocacy volunteer. Thank you again for being here today. And I'd like to start by saying that I think that all Iowans expect our leaders to come together on solutions to improve health care in Iowa. We think that expanding Medicaid is a necessary piece of this solution. With over 380,000 members in Iowa, AARP strongly supports expanding Iowa's Medicaid coverage up to 133% of the federal poverty level. That will provide Iowans with accessible, quality health care coverage. Look at the numbers. What does 133% really mean? It equates to $25,390 annual income for a family of 3, $20,123 for a family of 2, $14,856 for single Iowans. Then you look at who are these people. Currently, there are 17,204 Iowans between the ages of 50 and 64 who have no health insurance and whose income falls within these levels. That, if you look at a perspective, is equivalent to the city the size of Coralville or Johnston. Along with the reasons the hospital associations have given, AARP supports this expansion because it will reduce costly emergency visits and potentially catch and treat at an earlier stage our growing epidemic of chronic disease in Iowa, and we know that these chronic diseases become a bigger problem as we age. It will help Iowans who have lost their job or are struggling to find jobs or struggling in their jobs without health benefits to get access to quality preventative care so that they can be healthier and more productive. Iowans deserve a better health care coverage system than we currently have and that we've all paid for throughout our working lives. AARP will work to ensure Medicaid is there for hardworking Iowans that need this coverage. AARP is but one of the many groups that you see on the sign that have signed up in this statement of support, and we proudly thank everybody for this support and backing this particular effort. As you can see from these groups, they're broad agreement, and it's time to expand Medicaid now. We may all have different perspectives, but we join here to inform our Iowa State leaders that this is just the beginning of our work, and you'll be hearing from all of us and all Iowans more in the near future. Thank you, and John McCalley.
Thank you, Tony. My name is John McCalley, and I serve as the Midwest Advocacy Leader for the American Cancer Society Cancer Action Network. We are the nonpartisan advocacy arm of the American Cancer Society, and I'm happy to be here joining 48 other organizations to speak on behalf of expanding Medicaid in Iowa. We're here not as independents or Republicans or Democrats. We're here as Iowans committed to making this state the healthiest state with the highest quality of life. The American Cancer Society Cancer Action Network strongly urges Iowa to take full advantage of this opportunity to provide thousands of families with life-saving health coverage they need without having to face huge medical bills. To say no is to surrender to the status quo. It could mean a cancer diagnosis that comes too late, more expensive treatment, and a lower chance of survival. Plus, it would lead to more people going to the ER and a continuation of uncontrolled healthcare costs in our state. It is estimated that more than 17,480 Iowans will contract cancer this year. More than 6,200 will lose their fight against cancer in 2013, making it the second largest cause of death in our state. The American Cancer Society Cancer Action Network has a goal of reducing and eliminating cancer morbidity and mortality, but it cannot be realized without adequate health care. And Iowans seem to understand this. A poll our organization conducted last month showed that 57% of Iowa voters support accepting federal funds allocated to provide health care coverage by expanding Medicaid, while only 27% thought we should turn it down. The simple fact is individuals enrolled in Medicaid have better access to health care than those who are uninsured. If they get cancer, it's more likely to be discovered at an early stage as compared to those who are uninsured. Those individuals have also have better access to outpatient services, hospital care, prescription drug in Medicaid than those who are uninsured. Increased access to coverage is the gateway to reducing cancer in Iowa. So on behalf of the American Cancer Society Cancer Action Network, we strongly urge all public policymakers of this state to accept the money because it will save money in the long run and it will save lives. Thank you, and Tom Chapman.
Thank you. My name is Tom Chapman, and I'm the Executive Director of the Iowa Catholic Conference. I appreciate the opportunity to be here today and support the expansion of Medicaid. Our Catholic tradition teaches that health care is a basic human right, essential to protecting human life and dignity. Just 2 months ago, Pope Benedict told a meeting of healthcare workers that good health is a benefit that needs to be defended and guaranteed for all people, not just those who can afford it. At their core, healthcare choices are not just political, technical, or economic, but also moral. They are about life and death. Who can take their children to the doctor's office and who cannot? Who can afford decent health care coverage and who are left to fend for themselves? Health care reform especially needs to protect those at the beginning of life and at its end, the most vulnerable and the voiceless. And so for the 2013 session, the Iowa Catholic Conference supports making health care more readily available and affordable to all Iowans.